The purpose of our discussion this afternoon is to bring you up to date on a actual case that we treated several years ago, about 2.5 years ago, and we brought this patient along and completed her treatment, and we're doing her more or less final follow-up at this point in time. This is Mrs. Danley, and if you'll review the earlier part of this series of tapes, why you'll, I'm sure, recognize her appearance. On the other side of the chair there is Dr. Gaw, who has contributed immensely to her treatment, and he's going to take a little time to show you what he's accomplished in restoring her teeth. But before we get into that, I would just like to take a moment to review the radiograph. The extent of the lesion that this lady had can be seen very easily in this radiograph. It's quite large and extends distally to include the mesial aspect of the lower first bicuspid, and anteriorly to include the lateral incisor. So these 3 teeth were actually quite extensively involved in this large lesion that may have been associated more with a traumatic occlusion. Her treatment actually involved the redoing of the endodontics that had been initiated, and then completion of the therapy on the anterior teeth and the bicuspids and molars. And I think here on the radiograph you can see the work that was accomplished here on the central or the lateral cuspid first Notice the second bicuspid had to be removed. This was a result of the tremendous irritation from the temporary type of filling material that was earlier used. In other words, we're talking about a case that was actually diagnosed but not completely. We had to treat the first molar also, and I think you can see the mesial roots of the first molar. And can I just slide this film over to show you what the first molar looked like? Here it is right here. Here you see the first molar. This is actually a follow-up x-ray now of the first molar, and the restorative work has been accomplished. And I'm just going to see if I can slide this through very carefully just to give you a little bigger look at the void where the second bicuspid was at one time, and you can see the apices of that tooth look quite nice. And then let's just look at the others. This is the way the situation looks today. I'm going to slip in a couple more x-rays, and maybe you can get a little idea of our follow-up here. So you can see we've completed her treatment, we've accomplished her therapy, and I thought it'd be real nice today if we could have Dr. Alan Gaw discuss with Mrs. Danley just a little bit of the treatment that they accomplished in managing the treatment of this tremendous acute condition that over a period of time we did resolve and restored her to a good functional relationship. Okay, Alan, do you want to go ahead and take it from there?
Sure. Well, my role in this unbelievable drama, if you want to call it that, is quite minor, really. I more or less came in at the tail end of this, and Dr. Madden just called me one day and more or less asked me and kind of introduced me to the patient and asked me if I would like to do the restorative work on Mrs. Danley. And to which we have, over a period of what took us about 6 months or so.
6 to 9.
Yeah, it was a little bit more than we had believed at first. Well, anyway, we took on this job, and we started with the treatment. And because now the treatment is completed, all the restorative work has been completed on her. And well, how are you doing today?
I'm doing quite well. I'm quite satisfied, and Certainly am delighted that we're getting to an end of all this.
Yes, I bet you are. Tell you what, Mrs. Donnelly, Eloise, that's what I usually call you anyway. It's been, what, about a couple of months since we finished the treatment, hasn't it?
Mm-hmm. We
How-
finished it in May.
Finished it in May. How are you doing with that bridge in there now?
Oh, fine. It's fine.
No problem with it?
No problem.
Are you able to function on that whole side now?
Yes.
Good,
Fine.
good. What,
Chew again.
you could chew again, huh? Yeah. So, dentally, you are what we call in good oral health now, huh?
I should hope so.
No complaints, huh?
No complaints.
Well, that's good. That's good. What I'd like to do maybe at this time is to more or less review this case and kind of just go over slightly my part in it. When I saw, Mrs. Donnelly, she had a missing first bicuspid that was extracted, as reviewed by Dr. Madden. Her gingival condition was not, very good. The tissues were edematous and inflamed. So at that time, when we made out the treatment outline, we more or less made a complete treatment outline, and because of the fact also that her attached gingiva was not as much as we would like, we had a perio consultation, and at that time, it was thought that it'd be best to maybe do some sort of a periodontal therapy on her before we start any of the restorative work. So, what we did was did a curettage type of a therapy, and all this was accomplished, and more or less emphasized good oral hygiene at home, and she came back and everything, after the healing process and everything went fine. Okay, at that time, we started with our bridge, and we made a 3-unit bridge, replacing the missing first bicuspid. No, the missing second bicuspid, excuse me. So what we did, we did a 3/4 crown on the first bicuspid, did a porcelain Granian type of ponic, replacing the second bicuspid, and a full gold crown on the first molar. Okay, so at this time, maybe it'd be a good idea to show you actually what the bridge looked like. If you open,
Show her bite first.
okay, why don't we just kind of take a look at her bite in general? Okay, now if you open this Donnelly, there we go, and just bite down. Okay, now I don't know if you're able to see this. If I get my finger out of the way here. Open. There we go. Now just bite down. Yeah. If you're able to focus in and see that we more or less have replaced the arch integrity on that side, and she's able to function now. And if you're able to see the gingival condition, it seems to be quite nice now. I'm sorry, I think my finger's in the way. Yeah. Open if you will. Okay. Now perhaps we could show you the bridge.
Can I retract a little bit here?
Yes,
and
why
help
do,
Biddle?
please do.
Sure.
Because you're on the other side.
Okay, it's a little awkward here for Dr. Gall. Close, that's it, that's great. Can you get a look in there and you can see the nice work that she's had done there? You should get the other mirror, maybe you can hold it from the lane board. Or do I have it? Here we are.
Yeah.
Open real big on that here.
Maybe you can't see it. I tell you what, if you hold it from
Okay, close just a little.
from a position such as this, I think they might be able to get a good idea what it looks like.
Okay. That's good.
Yeah.
I think it shows
The
nice.
the inlay in the second molar was also done, because when we did the bridge, we found some decay, and the margin on the restoration that she had wasn't good. So at that time, we also replaced the inlay. So as you can see, we have replaced really more or less the whole posterior arch on that side. And hopefully she's able to function with it now.
The anterior teeth, cuspid and lateral.
Now the cuspid and lateral, I didn't, do any, restorative work on. I think maybe Dr. Madden could tell you a little bit more about that.
Well, we felt they were strong enough so that we didn't need full coverage, so we just placed silicates in the lingual access cavities, and they look real good. They're still. We've got to keep an eye on this young lady for some time, but I think the bite and the position of the teeth certainly indicate where some of the problem originated from in her total treatment. But she's looking real good. She's looking real good.
Yes, she does.
Why did you put a 3/4 crown on that bicuspid? I noticed the first bite has a 3/4 crown on it.
Yes, well, because at that time when we made our diagnosis, well, number one, I guess probably the main concern is aesthetics for Mrs. Danley.
Okay.
We want to get her nice and pretty, not only functionally, her teeth functionally, but we want to, get her so that she'll be looking real pretty. But anyway, speaking from a dental standpoint, though, at the time we made the diagnosis, and we had perio consultation, because of the fact that she didn't have too much attached gingiva, and the fact that there was some pocket, formation in that area, what we felt like at the time is best to make a 3/4 crown, so therefore not encroaching upon the gingiva itself, so therefore maybe this will more or less give her better periodontal health, you see.
It sure looks good in there today. Looking with the mirror here, I noticed, and I don't know if they can see this or not, close together just a little, still see a scar on the mucobuccal fold area right in about halfway up the ridge there, which reminds me of one of the earlier appointments that we had with this young lady when we were doing incision and drainage and all kinds of other things, just trying to get her comfortable. Mrs. Danley, do you recall some of those earlier days when you first came in here for treatment?
I certainly do.
Do you have any particular feelings? Would you reflect on anything that's happened over? I know it's been a long, hard thing for you. You've been a good patient, very delightful one, and our students have gained a lot of experience working with this young lady. But through all this, she's been just great, and I was wondering if she had any wisdom that she might give us or our students or our patients or anything that might be helpful further on down the line.
Well, I do have a little gem of wisdom I'd like to say to anyone who happens to view this film. Go to a good endodontist if you have any root canal problems. Otherwise, I'm just very thankful and I'm very appreciative to the University of Texas Dental School for the care they've given me. I started out with, which I thought was going to be a private patient, and ended up having the whole faculty work on me and assist me. I was in great pain. I've had, well, I just can't compare it to anything I've ever had before. But I just appreciate everything that's happened to me since I've been here. I've had, I feel like now that I'm on the road to good dental hygiene, and I'm just very thankful that we're coming to an end.
Well, it's sure been nice having you. You've been real cooperative. I might add, now this may not have come out in our discussions, and I kind of kidded Mrs. Danley just a moment. I said to her, now don't say anything negative, but I don't really care if she says something negative or not. But I've talked to her, and I realize that she still has a little discomfort, a little deep bone-type pain from time to time. She's a clencher, and she knows it, and she knows this is not good, and we've got a lot of endodontics riding in her mouth. And certainly she's chewing and living and breathing. She's had bite night guards made, and I think this all contributed to her initial problem of pulp, lack of vitality in various teeth. But that, coupled with a little bit of treatment with medications beyond the apex and so forth, has caused her to become maybe a little bit allergic to certain things. She has said to me that even xylocaine causes her excruciating pain now, whereas earlier it didn't. And particularly on the right side as compared to the left side, although we haven't really studied this in detail. But I imagine she's going to have some residual effects that'll last for a while. But I think she will agree without any coaching, and I'll just ask her, are you better or worse?
No comparison.
Very
of
no,
course.
no question, okay.
I mean, if it was better or worse, I'd have to say I'm well.
Okay, sure. So she's willing to put up with these little things, and maybe time and tender treatment and a watchful, waiting approach to it is what we need at this point in time. And we're going to have her back in probably about 6 months to check up on her again to be sure that everything is okay. Now, I do have a lateral jaw x-ray that maybe we can focus in on over here, and just to show you the most recent lateral jaw as compared to the preliminary radiograph that we had 2.5 years ago. Maybe we can see the difference in the character of the bone on this ray. Yeah. You can see we can begin to determine where the apices of the teeth are and that they are in bone. It may not show up as well as I'd like it to, but believe me, they're firm, the teeth are not mobile, and the situation has improved considerably. Clinically, we would say we have a very successful treatment. We have a happy patient, and we're happy to share this experience with you. Thank you very much, Ms. Stanley.
Thank you, Doctor.
Alan?
Thank you, Dr. Gold.
Pleasure.
Thank you. It's been an interesting experience for me too. Speaking from a student standpoint, last year when I was a senior student and going through this case, I really learned a lot, and it's really nice to see a case starting from the beginning and then going to completion. So it was a wonderful learning experience for me also.
Thank you, and sure appreciate your help.